It was parted across 3 wards within the organisation with the aim of reducing restricted practice in terms of physical intervention and medication-led restraint. And what we found was real positive outcomes in terms of a reduction in physical restraint and also a reduction in work-related sickness. So the organisation identified No Force First as a key priority, and by April of 2016 we'd engaged all inpatient wards across the organisation. We co-produced and co-developed engagement sessions which provides frontline staff with a narrative from the service user's perspective around the impact that physical restraint has upon them. And I guess what that does, that engages the hearts and minds of staff around the actual reenactment of trauma. So our ward managers receive incident data on a weekly basis, and what that enables them to do is to identify any themes in relation to conflict or incidents, which then them, alongside the service users on the ward and the wider MDT, can think about some critical solutions to address those problems. We've seen significant reductions in the use of physical restraint. We've seen work-related sickness reduced by approximately 1,800 days, which equates to approximately £246,000. We've moved from a culture that containment and control keeps everyone safe to working side by side with our service users and delivering a more recovery focused culture. The team that is actually driving this agenda are extremely compassionate and driven. They're relentlessly positive, they're unconditional, despite the challenges that we face on a day-to-day basis. And I guess we've been able to spread that drive across, we feel, all inpatient wards at Mersey Care, which is leading to these significant reductions in use of physical restraint and restricted practice, a reduction in assaults on staff. We did win 2 national awards last year, one for improving patient safety and one for quality improvement. And following on from that, we've been contacted not only by a large number of organisations within this country, but also across the world. So we've been sharing best practice and something that is a work stream under No Force First is the work that we've been doing around reducing long-term segregation. Unfortunately, we are nursing some of the most complex, challenging, stigmatised people in the country, long-term segregation. And through the work of the Positive Intervention Programme, research that was undertaken at Ashworth Hospital and the literature, myself and Dr. Jennifer Kilcoyne have developed a clinical model of care called the HOPES clinical model of care to reduce long-term segregation. And through the positive outcomes of embedding that in clinical practice at Ashworth Hospital, we've also piloted that approach and now embedded it at Rampton and Broadmoor High Secure Hospital. And following on from that, we were approached by the High Secure prison estate. So we've delivered training to the 8 High Secure prisons in England, and they piloted this approach across 3 high secure prisons, HMP, Belmarsh, Long Lartin and Wakefield, and the feedback's been extremely positive in terms of reductions in long-term segregation between 17 and 35%. But more importantly, the element of co-production is becoming embedded because the prisoner and prison officer relationships are improving. So we're going to have service users working side by side with instructors delivering training this year. So that's the plan, but we're in the process of that. And we're probably going to be the first organisation to do that from a high secure point of view. I received an invite from Buckingham Palace. This isn't about me being nominated. I guess I'm just representing frontline nursing at Mersey Care and the continuous hard work that not only our frontline nursing and other disciplines do, but also the work that our service users have been supporting with this agenda. Bringing in a just and learning culture We've already seen positive outcomes in terms of our nursing staff, you know, thinking creatively and taking positive risks and not being concerned if things don't go to plan. You know, we are supporting some really complex, challenging, stigmatised people, and I guess at times we need to be able to take positive risks to be able to support their recovery, and I guess that's exactly what the Just and Learn culture is enabling us to do at Mersey Care.